All right, and strong and healthy teeth is what we want. And of course, that is our subject of discussion today. Good morning. How are you this morning? As always, thank you so much for joining us on My Doctor. My name is Winnie Lubem, of course, like we said, and from the video today, it's all about oral hygiene. And of course, oral health is a key indicator of overall health, well-being, and quality of life. However, oral diseases are the most common non-communicable diseases that, and of course, affect people throughout their lifetime, and thus causing pain, discomfort, disfigurement, and even death. So stick around till the end of the show to understand how one can get to that extreme of, disfigurement and death. But you know the drill by now. If you have any question in relation to today's topic, that is on oral hygiene, please give us a call on 0791-478990, or better yet, send us a text message on 40920. We'll be looking at your questions a little bit later. But for now, my guest is here. Good morning.
Good morning.
Long time no see.
Yes, it's been a while.
It's been a while.
Almost a year.
Yes. How are you doing?
We
can say
fine.
Happy New Year, but the New Year is almost coming to an end, so it's fine. We'll forgive you for that.
Right.
But before we get into the discussion, and since it's been a long time, and I'm pretty sure people have forgotten who you are and what you do, just kindly remind them.
Good morning, Kenya. My name is Dr. Paul Murumbwa Onyancha. I'm a dental surgeon by profession. So basically, I deal with teeth, anything that deals with teeth.
Yeah.
I treat patients who have, diseases that affect the teeth. Yes.
All right. Karibu sana. Now, let's just go back to the basics.
Yes.
Good oral hygiene. I know most of the time we're told to make sure you brush your teeth twice a day. Some people do, some people do not. So then, good oral hygiene, let's just start from there. What does it mean and what does it entail, really?
Good oral hygiene basically is a practice that somebody makes to ensure that their teeth is clean and is free from diseases.
Okay.
So there are certain habits that one should be having, should put in place in their day-to-day lives. All right. Which includes brushing of their teeth at least twice a day. Okay. In the morning and preferably before you sleep. Okay. Then you have flossing of your teeth, that is usage of a special string that cleans between your teeth because there are areas where your brush cannot reach. Yeah. So you need a dental floss that can be able to clean between your teeth. Yeah. Yes. All right. Then you have things like usage of mouthwash, which has antibacterial effect. Remember, bacteria loves sugar, and this can, lead to gum disease if you're having the interaction between bacteria and sugar. Okay. Yes.
But you see, I like what you said. At least twice a day. That is on brushing, so you can brush as many times as you want. Because I know some people who would brush after every single meal. So whether it's a main meal, whether it's a snack, whatever, as long as they have something in their mouth, they would have to brush after. Yes. Is that safe or is that too extreme?
Well, it really depends. Okay. There's no harm in brushing your teeth after every meal. Okay. But studies have shown that brushing your teeth at least twice is, effective in preventing gum disease and diseases of the hard tissue of the teeth, such as dental caries. The reason being, as you eat your food, there's something called plaque that forms on the surface of your teeth. So basically, when you're brushing your teeth, you're removing plaque, because plaque will attract more bacteria and cause gum disease. Now, the danger with brushing your teeth too much is you might cause gum recession. Yes. Because the bristles that are on the brush are mechanical. And the tissues, the gum is a tissue. Yeah. And it has blood vessels, and it's a living, organism in itself. So basically, if you continually cause friction on your teeth and your gum, and you probably are not doing it very well, you might actually cause a lot of problems like abrasion. So I would recommend twice, especially before you go to sleep, because when you go to sleep, there is lack of proper salivary flow. Yeah. Your mouth is closed. In the mouth, yeah. Yes, exactly. So you tend to get more, gum disease at night. At night. Exactly. Okay. Yeah. So twice a day is good. If you can manage 3 times a day.
3 times. Okay.
Yes,
All right. Well and good.
Okay.
But then keep in mind the aspect of then gum recession, because of course from that you expose your teeth. Like,
yes.
Yeah. Where anyway, we'll talk about that later on.
Yes.
But now, fine. Brush at least twice a day.
Yes.
We try. Sometimes we don't. But then again, is the kind of brush one uses also a factor? Because I know of some people who believe that the tougher the bristles, the more cleaner the teeth are.
Well, that's a misconception.
Okay.
Actually, as dentists, we recommend that you use a soft bristle brush.
Okay.
Because this brush is going to be friendly to your teeth. If you use a tough brush, and it has been shown that the longer you use your brush, if you don't change it after 3 months, the bristle starts becoming very hard. So that becomes injurious to your gum.
Yeah.
So personally, and I know this is a view that is shared by many dentists,
Yes.
it's important to have a soft bristle brush.
Bristle brush, yeah.
Yeah, to be able to take care of your gum.
Yeah.
And of course, so that it doesn't cause abrasion.
Okay.
Yeah.
All right.
Because we see patients having abrasion,
Mm-hmm.
and of course, when you have abrasion of the enamel, you're exposing your second layer, which has nerves, and patients get sensitivity.
Yes.
Yes.
Okay. And we'll talk about the aspect of sensitivity.
Yes.
Again, is it like exposure to, again, too much brushing and, of course, using a very, very tough brush? But then again, for the children,
Yes.
when do we introduce brushing of teeth? Because I know for so many parents will be like, oh, well, but my child is too young. And you see the aspect of gagging. We do not want that to happen.
Yes.
Or most of them don't know that you're supposed to spit out the toothpaste, and as compared to swallowing, because most of the children, of course, will end up swallowing. So then at what age is it recommended to introduce, so that, of course, you inculcate that aspect or culture of brushing your teeth at least twice a day?
I would recommend, beginning of brushing with teeth when the milk teeth have already come out.
Okay.
Roughly around 6 years. When you start seeing the milk teeth coming out, it's good to start, using a soft cloth to remove plaque.
Okay. Okay.
On the teeth. Just because, just like adults, children also get, gum disease.
You do.
And because they develop plaque. So it's important to use a soft cloth to remove the plaque on your teeth, or on the baby's teeth.
Okay.
And even
The gum?
well, the tongue. I was going to say the tongue.
Okay.
Yes,
All right.
exactly. Yeah.
Okay.
Yes.
Okay. Okay. And so how do you do it? Because I have tried with my niece,
Yes.
and it's very, very difficult, especially the back of the tongue. It's very, very difficult because they gag and you're scared what will happen to, all those things. So then how do you do it? Like, what's the best way to help a child, of course, not get, or a buildup of plaque, especially at the back of the tongue where most of it happens?
I would advise that you do it gently.
Okay.
And if you cannot do it, it's better to visit a dentist so they can be able to do it professionally in the clinic, because we have special equipment and special chemicals that can be able to do that. But this is something that you can do at home. And of course, as the child grows, it becomes a habit. When they see you brush the teeth, they will also want to brush their teeth as well.
Yeah.
Yes.
Okay, but then again, so then the aspect of toothpaste.
Yes.
Which toothpaste or the content in the toothpaste? What is some of the things that we should avoid, and which ones are good for us? And can you use the same toothpaste as for an adult, use it on the child? Because we see most families do so.
Now, any toothpaste that has fluoride, because it's controlled, the amount of toothpaste that is, the amount of fluoride that is in the toothpaste has been shown to be protective to the teeth. So any toothpaste that has fluoride is good for the teeth. But I would discourage parents from using a highly fluoridated toothpaste to children. I don't want to name the brands.
Okay.
I don't want to name the brands. But children cannot tolerate too much fluoride, yeah, because it can be actually toxic to them. And like I said, if you're in doubt, always visit your dentist. They can be able to advise you on, you know, how to go about it. Yes.
Okay, so then how do you know? Is there like a specific percentage that is recommended for fluoride? And if so, is it written, mostly written at the back of the toothpaste, so that people know? Because again, sometimes we might just say, oh, well, a toothpaste is a toothpaste, the child will use it, an adult will use it, but like you said, it's not recommended for children if it's too much. So how much is too much? Is there like a specific percentage?
We normally recommend 1 part per million.
All right.
Yeah, 1 part per million levels, which is safe for usage. But for children, we need to be cautious, not to use too much.
Okay.
Yeah, again, you know, just a little toothpaste, like a pea shape.
Yeah.
You put it on the toothbrush and then use it for. And then you encourage the child to spit, because most children. You know,
they will end up swallowing, especially the toothpaste for the children, like the one that is specifically meant for children. It's very sweet and very tasty.
Yes.
So most of them will end up swallowing instead of spitting.
Yes, but in the clinic, we normally show them on how to do it.
Okay.
So I would, because this is a public health concern, and it's a public health issue, you know, we encourage parents, guardians, to bring the children to the dentist. We will be able to show them on how to use it. Yes.
Okay. But why then? Okay, what could happen? This is just out of curiosity. What would happen if a child keeps on swallowing the toothpaste for a very long time? What could happen?
Of course, the fluoride level, when it becomes higher in the body, can cause toxicity.
Oh wow.
Yeah, to the internal organs. So this can be an emergency. So we encourage that if you feel that your child can access to, let's say, toothpaste, make sure you store it where they cannot be able to reach. Yes.
Okay. So fine. So brush twice a day if you can. That is at least. You can brush thrice a day. Well and good.
Yes.
Use the right amount of toothpaste and all those things.
Yes.
So now the aspect of brushing, the technique. How do we do it? And is there a recommended time? Because I hear people say, oh, well, you're supposed to brush your teeth at least 3 minutes, or it shouldn't be anything shorter than that. So can we just go through the technique very briefly? So
basically, the key thing to remember is always take your time to brush your teeth.
Okay.
Don't be in a hurry. I know some of our patients come to the clinic and say, well, in the morning I'm very tired.
Yeah.
You're rushing. I'm rushing to work.
Time.
I don't have.
Yep.
So it's good to take your time. 3 to 5 minutes would be, adequate, because that will ensure that you thoroughly brush your teeth.
Your teeth, yeah.
Yes, and it's important to brush your teeth in circular motion, slowly, gently, on all the surfaces of your teeth, including the back, going all the way, and then you go inside the mouth. We call it the buccal surface. Then you have the palatal surface. Then you have the occlusal surface. Occlusal surface is where the upper teeth and the lower teeth meet.
Yeah. Okay.
Because there are grooves there where food and bacteria can, get dislodged and cause dental caries. So it's important to brush all the surfaces of your teeth.
Okay.
And then, of course, there are people who are left-handed. Those who are right-handed.
Right-handed, yes.
So the ones who are right-handed would tend to brush this side more.
More, true.
Yeah.
You're right.
So as dentists, when they come to the clinic, you'd actually see more abrasion on the left side if they're left-handed.
Yeah.
So it's important to ensure that you have equal brushing, and especially all the surfaces of your teeth.
Okay. All right. And then what about the tongue? Because there's some people who say, oh, well, you are not supposed to brush your tongue every day or every time you brush your teeth. Is that true or not? Well,
you're supposed to brush your tongue at least once a day.
Okay.
Yeah, not too much, because the tissues on the tongue are very soft.
Yes.
if you brush your tongue after every meal, you're exposing your teeth to abrasion, to wear, and it can actually cause ulceration because they're actually salivary glands that are, on the upper surfaces of the tongue.
Okay.
So you don't want to injure them and cause other health problems.
Yeah.
Yes.
Do you also alter your taste buds? When people say that, like the more you brush on your tongue, you tend to alter with your taste bud, and then years later, you will never ever have like the actual taste of food or whatever it is that you put in your mouth.
Well, the good thing with the tongue is that just like the gum, or what you call the gingiva, has a high reparative capacity. So there's a way the tongue repairs itself, but of course, if the amount of force and the duration of brushing of the tongue becomes much larger, you tend to lower that capacity to regenerate. So you don't want to end up having, ulcerations and alteration of taste bud, because as we've seen, even mouthwashes can actually cause, alteration of taste sensation.
Yeah.
So it's important to be a bit gentle, because these are very fragile tissues.
Okay.
And you don't want to cause any injuries.
Okay.
Yes.
So wait, so what are you saying in terms of, as far as, because I was about to ask you, wait, is a mouthwash really necessary? Because there's some people who don't use mouthwash, and I think they don't have problems. And there's some who use it but still have issues. And I mean, and even back then, our parents and grandparents, I mean, first of all, they didn't have the kind of toothbrush that we use now. They used sticks, and they didn't have toothpaste, and they were okay. Most of them were okay. So one would ask, I mean, is a mouthwash really, really necessary? And if so, then how frequent are we supposed to use? Because like you said, again, you also don't want to cause problems, much as you're trying to prevent, dental diseases and conditions.
Well, a mouthwash is very important.
Okay.
Because number one, you may not be meticulous in your brushing. And remember, like I said, there's bacteria in your mouth. And the bacteria can also, can cause gum disease, can cause dental caries. So basically what the mouthwash does, it reduces the level of bacteria that is harmful. And of course, I mean, the mouthwash, because it's fluidy, it can actually penetrate into the... Exactly. So we recommend chlorhexidine-based mouthwashes for your regular, usage. Don't use the stronger ones. There are mouthwashes that we recommend as dentists to patients who have had who have undergone surgical procedures. Those are not supposed to be used for more than a week. Exactly.
Or because they are a little bit stronger.
Exactly.
Okay, so we take a very short break, but of course it's very important for us to just have the base covered. And then when we come back, we'll also talk about some of the signs and symptoms of dental problems, some of the dental diseases and conditions. So if you have any question in relation to the same, please feel free to call us live on 791-478990, or better yet, send us a text message on 40920. We'll be looking at your questions after this very short break. Stay with us. All right, welcome back. Glad you're still with us. This is My Doctor, and just in case you're tuning in right now, our focus today is on oral hygiene. And of course, before we went for break, we covered the base. I mean, why is it important for you to brush? How long are you supposed to brush? And all those things. So we covered that during the first part of the show. So now we want to focus on then some of the signs and symptoms of dental problems and some of this dental diseases that of course we encounter on a day-to-day basis, if not every single day. So if you have any question in relation to today's topic, then feel free to call us live, or 791-478990 is the number to call through. Or if you have issues with your oral hygiene in general, you can also send us a text message on 40920, and we'll be looking at them in a short while. But for now, can we then discuss some of these common health problems that we encounter and even you as dentists come across?
Well, where to start?
All right, a lot.
There are so many conditions that affect the oral cavity. Basically, if if you just look at how the oral cavity is structured, the anatomy, you have the tongue, you have the teeth, you have the palate, of course you have the gums and the blood vessels, the salivary glands.
Yeah.
So basically, if we start with the teeth, there's something called dental caries. So dental caries is one of the hard tissue diseases that affect the teeth, and is basically a progressive condition that causes loss of tooth substance, the hard tissue. On the outside of the tooth, you have the enamel, the second layer being the dentine, and the third layer is the pulp.
Okay.
So what people commonly call holes on the teeth are called dental caries.
Okay.
Yes.
Okay.
Now there's also gingivitis, which is inflammation of the gum, but it's under a cluster of conditions we call periodontal diseases. So under periodontal diseases, basically what you have is diseases of the tissues that surrounds the teeth. That is periodontitis and gingivitis.
Okay.
Gingivitis is a milder form of the periodontal diseases, which can progress to periodontitis. So basically you move from inflammation of the gum, which if left untreated, now goes and attacks the periodontium and the alveolar bone that surrounds the teeth. Then you get now periodontitis. They present differently, but they have similar characteristics.
Okay.
So basically, when you have gingivitis, you have inflamed gums. So around the margins of the teeth, you find the gum is swollen. It appears red, and then it also bleeds on slight provocation. When you brush your teeth, you tend to find blood oozing from the mouth. You can also have bad breath. Yeah, bad breath is also a sign of gum disease. And other signs and symptoms.
Okay.
Now when it moves to periodontitis, now you start having mobility of the teeth. The teeth becomes mobile, and some of them fall off. Patient feels a lot of pain. You can have fever, chills. So it's important to visit your dentist to have these conditions addressed. Yes.
And you see, most of the time,
Yes.
and especially as far as inflammation is concerned, I mean,
Yes.
most of us tend to think, oh, well, maybe I was too rough when brushing, and then, of course, my gums are inflamed. We don't really seek treatment with that. We wait until maybe it will go away on its own. So is this the aspect of waiting for it to go away on its own? Does it make the condition worse?
Yes, of course, if you wait, the conditions becomes worse. Even the treatment becomes a bit more complex.
Complex, yes.
Yeah, because as dentists, we've realized, yes, the health-seeking habits in Kenya has improved. More people are going to the dentist to have their regular check.
All right.
But most patients that I see in my clinic tend to come when there's pain.
Yep.
So we discourage you to, from just coming when there's pain.
When there's
Always
pain.
come, at least twice a year for your dental check, because when you come for your regular dental checkup, we can be able to, show you. In more advanced clinics, you can actually have, an intraoral camera can show you on a screen the general status of your teeth.
Okay.
So we can be able to pick small cavities that should be attended to before they become large. Remember, when you have a small cavity, the treatment would be a filling. The moment it becomes large and it goes all the way to the pulp, the treatment changes from a filling to a root canal treatment.
Okay.
Yes, exactly, which is
Yeah.
more invasive
Yes.
than a filling.
Yeah.
And even in terms of cost, it becomes more costly to treat patients who requires a root canal treatment than a filling.
Yeah.
Yes.
All right. And I think we'll talk about then all those options later on, because there's some people who believe
Yes.
that the only way to deal with, and especially when there's pain,
Yes.
is just tooth extraction. But of course, there are different ways that you can do that without necessarily having to perform tooth extraction.
Yes.
Okay, so then, as far as the diseases are concerned, and we talked about foul smell in the mouth, and I want to ask, are there people who, I don't know if it's genetics or what usually happens, because this person has a foul smell all the time, whether they brush their teeth or not. There's that smell and it's not good. And I don't know if most of the time they know or they don't know, because I think to them it's normal. So they don't know whether this is bad or this is good or what's normal in between.
Yes.
So is there anything like genetics playing a role as far as that is concerned?
Well, not that I know of.
Okay.
Basically, when you start from the baseline, when a patient presents with the bad breath, what we call halitosis, that's the technical term for it. The first thing that comes to mind is gum disease.
Okay.
Okay, gingivitis, periodontitis, that can cause bad breath, which goes away when you use a mouthwash and you come for your scaling and polishing.
All right.
So basically, when you have inflamed gums, and I mean, like I said, gum and oral tissues are living tissues. So when they get diseased, they start to produce bad smell.
Yeah.
So basically, when you come for scaling and polishing, we are removing what you call tartar, and plaque.
Yeah.
Because this is like a calcified mass that is embedded on your teeth, between your teeth and your gum.
Yeah.
So when you remove it, we ensure that the teeth goes back to healthy being. Now, there are some conditions, there's some situations whereby the halitosis or bad breath will not go away.
Yeah.
So we start, thinking about maybe you have an ENT problem, because you can have infections on the throat that can also cause bad breath. So when you come to the dentist, we'll, evaluate and then refer you appropriately. And of course, the other systemic condition can cause bad breath. But the baseline is, the keyword is always come to the dentist for your regular checkup and cleaning, so that you prevent bad breath. Now, because bad breath sometimes it's a psychological issue.
It is.
People don't want to be told that they have bad breath.
Yes.
Because it will affect their self-esteem.
Yeah. and it's even uncomfortable to just tell someone, well, this.
Exactly.
Yeah.
So I think the safest way is to come to the dentist, because we'll give you that privacy and confidentiality. We will tell you right on your face that you have bad breath, and this is because of gum disease.
All right.
And then we'll, we will, treat it.
Advise appropriately.
Yes, exactly.
All right, because I was about to ask then, suppose someone does not have gum disease, like they're just okay, like the mouth, everything is fine, they do not have any condition or any disease or dental, again, condition. Could it be then, like, let's say the guts, aside from an infection on the throat, the gut or just stomach or just anything, something is wrong?
Yes, when you have conditions that, affects your gut, that goes all the way to esophagus, basically what you call GIT problems, you can have bad breath.
Yeah.
So we recommend that once you go to the dentist and they ascertain that the problem is not coming from your teeth and from your gum, we refer you to a gastroenterologist who will be able now to treat that condition so that the bad breath is contained.
Yeah.
Yes.
All right. Because I mean, it might be difficult, because someone would say, I brush every day. I use the dental floss. I use a mouthwash, but it's not going away. Okay. And then something else that I found interesting was stress and dental conditions. How are they related? Because we all get stressed almost all the time.
Well, when you get stressed, basically your immune system is lowered.
Okay.
And anything that lowers the immune system prevents you from fighting diseases.
Right. Okay.
So the mouth, just like any other part of the body,
Yeah.
can also, have a manifestation of stress. So you can get, blisters and of course, patients who are stressed sometimes may not brush their teeth meticulously as the ones who are not stressed.
Yeah.
But basically, what you're asking is that relationship between the stress and the oral cavity is basically an immune system issue.
Okay.
So when the immune system goes down, you have
you're prone to getting infections and disease and all that.
Exactly.
To what level then? Because you see, we all have our own levels of stress and all those things. And I mean, it's different from person to person because let's say the way I am able to handle my levels of stress is not the same as yours and vice versa. So are we talking about like those extreme cases where, let's say, we do not have control over, and sometimes we don't, because there's some people who, most of the time they'll tell you, no, me, I'm not stressed, I'm okay. But in real sense, they are stressed.
Well, I think I would answer that question by saying that the stress levels that the body cannot be able to contain.
Okay.
Because there's a way the body tries to contain the stress. Because the immune system now kicks in and prevents you from your body, getting too much stress that it cannot be able to fight infections.
Yeah.
There are other factors that can come into play. For example, if you're immunocompromised, there are patients who have, immunocompromised, HIV. So if you combine the immunocompromised state and then the stress, now you get manifestation in the mouth. But most patients would, fight their stress levels if the immune system is good.
Yeah.
But if it's too much, now you start getting the immune system going down and the dental infections going up.
Okay.
Yes.
All right. And then we talked about an aspect of then systemic diseases and, of course, dental or oral hygiene or dental problems as well. And one of them, I think, is diabetes in terms of then the teeth are weakened and all those things. Can you just help us understand how these two, come about?
Now, basically, when you have diabetes, you're going to have weakened immune system, and the reparative capacity of the body is reduced.
Yeah.
And because gingivitis and dental caries is a bacterial infection that affects the body, that affects the teeth. When you have diabetes, your immune system is down.
It's down, yeah.
Your reparative capacity is also down.
Okay.
So patients who present with diabetes tend to have prolonged healing. So when they get bruised on their gum for whatever reason, during the dental procedure or when they're brushing their teeth or when they get injured mechanically, they tend to heal much slower compared to someone who doesn't have diabetes. So we recommend that when a patient comes to the dental clinic and the dentist takes the history and then the patient tells them that they have diabetes, we encourage that they continue visiting their medical doctor because those two can have the diabetes can have an effect on how we treat our patients, because we can try as much as possible to be meticulous in doing our scaling and polishing, but if the diabetes is not controlled, this might affect even how we treat as dentists.
Okay.
Yes.
All right, so can you answer some few questions here?
Yes.
This one says, my gum hurts. I took hard meat that hurt my gum, and now it's swollen on the right side of my last tooth. I'm taking painkillers and mouthwash. What can do to reduce the swelling?
The gum is the gum is swollen on the right.
Swollen. Yes.
On the right side.
Yes.
First thing, the patient needs to go to the dentist to have the gum swollen checked, because there are other reasons as to why your molar tooth maybe, may have a gum swelling around it. I would think the patient could be having just the localized gingivitis. What we call localized gingivitis is gum swelling on one side of the tooth that is not generalized.
Yeah.
And depending on the age of the patient, of the person who was texted, it could also be a third molar that is coming out. When the third molar is coming out, sometimes you can get gum, coming on top of the tooth. Yeah, what you call an operculum.
Yeah.
This can be very, very painful because food and bacteria gets, dislodged between the gum and the tooth.
Yeah.
So when the patient comes to the clinic, we'll do an X-ray, we'll do a physical examination and do an X-ray, what you call an IOPA, intraoral periapical view. Then we just see how the tooth is.
Okay.
There are two ways we can be able to treat it. We can do an incision and removal of the gum, what we call operculectomy.
Okay.
Or we can do the removal of the tooth.
Yeah.
But if the tooth is impacted, so we do surgical removal. Yeah. But the key thing to remember is just go to the dentist.
Okay.
Let the dental practitioner have a look at the tooth and decide what is causing the gum swelling, and then treat appropriately.
Sounds painful. Okay. This one says, hello, this is Brenda from Nairobi. I have a problem with cheeks. They are darkening and have things like traces. So I see zinanea is, as in even the tongue, chini yake, it's also affected, and I can't take anything hot. Please help.
There are conditions which will affect the cheek. There are patients I see who have teeth which have been removed. So when you remove, let's say, a lower tooth, the upper tooth doesn't have its counterpart.
Yeah.
So it tends to overgrow. So with time, you find injury to the gum, sorry, to the cheek.
All right.
Or you can find the cheek gets embedded between the upper teeth and the lower teeth, what you call the cheek bite. So that can cause changes on the cheek. Yeah, you get changes because you're having mechanical damage of the mucosa of the cheek. So it's important to go to the dentist, let them have a look and find out why you're having the cheek bite. And if you're having changes within your tongue or gum or cheek, it's important to go to the dentist because that could signal something more serious.
All right.
Yeah, because there are cellular changes. The cellular changes that occurs on the cheek that can lead to even oral cancer. So it's important to go to the dentist, let them have a look. We normally do what we call a biopsy. We remove a tissue and then you tend to send it for histopathology, which is basically looking at a tissue under the microscope so that we see exactly what's going on there.
Okay.
So when they're having those kind of conditions, it could mean anything, and the dentist would be much better placed to make up diagnosis.
Okay.
Yes.
All right. Don't wait.
Yes, don't wait.
Because we do that all the time.
All the time.
Okay, talking about oral cancer, then can we talk about the earlier signs? Because I think it can mimic other conditions, and of course, as just being typical people, where we wait and see, oh, well, this one will just disappear on its own, and then it doesn't. And the more we wait, the more the condition worsens. So can you talk about some of the early signs of oral cancer, and where does it begin specifically?
Well, oral cancer, just like any other cancer, doesn't have a known cause.
Yeah.
It's important to know that. But there are factors which are considered associative factors to oral cancer.
Okay.
So a patient will come to the clinic and tell you they've been, chewing cud or taking alcohol, or they've been chewing mirror, taking tobacco. So these this and the physical examination that the dentist will do would now start, giving that practitioner an indication that this is getting into cancer. But of course, there are signs and symptoms that we see. A patient would come and say they have pain, dental pain, or they have pain on the gum. So when the patient opens their mouth and we do a physical examination, we see changes in color around the teeth, that is, redness, and the margins are not well defined. Yeah, so when you see that, we start now, querying, oral cancer. So of course we will do a biopsy and send it for histopathology, that is looking at the tissues under the microscope, and then a diagnosis of oral cancer is made. So and of course there are stages of oral cancer. If you come when the oral cancer is at an early stage, it's easier to treat, and the prognosis is much better. When it's at advanced stage, it has already metastasized. It has gone to, let's say, the neck and the surrounding tissues. The prognosis, which is now the likelihood that you're going to get healed, becomes much, much lower because there's so much tissue destruction. And of course, the immunity goes down. The patients come when they cannot be able to feed. Yes.
Okay.
Yes.
And how aggressive is it? I mean, compared to other types of cancers, how aggressive is oral cancer? Does it go from one stage to the other in a very short amount of time, or it takes a little bit of time?
It takes a bit of time. It's not like the other cancers which are very aggressive. But depending on the level at which it has been detected, now it becomes more aggressive or less aggressive. If you find it at a later stage, it becomes more aggressive. It becomes very hard to treat. Patients now just settle for palliative care because there's nothing much we can do. There are other methods of treating. You can actually do surgery. You make an incision and then you remove what you call healthy margins. But that is normally dictated by the level at which the cancer has spread. Yes.
Okay.
And of course, there are medications that we put the patients on.
All right.
Yes.
Okay. And at what age do we see this mostly? Or is it even a factor? Because I don't want to believe we see a lot of oral cancers in children or even in adolescents.
It can be seen at any age.
Okay.
But mostly we rarely see it in children.
All right. Okay.
So middle age to very elderly and immunocompromised patients.
All right.
Yeah.
Okay. And then are there environmental factors that also bring about either dental problems or changes in, because we know some parts of the country where, of course, depending on the kind of water they take, there are changes in the color as far as their teeth are concerned. But are there other environmental factors that contribute to some of the dental diseases and conditions that we talked about?
Environmental factors, I would think about high fluoride content areas.
Yeah.
There are areas where the fluoride content is very high. Yeah, like in Kenya, you find patients who are coming from Nakuru or patients who stay in Ngong area.
Yeah.
They have a high fluoride content. And also patients who use borehole water tend to get what we call dental fluorosis, which is basically changes in color of the teeth because of the fluoride which has gone into, which has embedded itself into the into the tooth. So basically, that would be one. The other environmental factors would be the kind of food you take. So if you can consider food as an environmental factor, then yeah,
all right.
You know, high intake of sugar, chocolate, sweets can also cause you know, dental caries and dental disease. But of course, these are lifestyle conditions.
Yeah, conditions that we can always do something about.
Yes, exactly.
Okay, so then can you then on that note just talk about a healthy diet, because I can see our time is far much spent.
Yes.
So very briefly, in terms of healthy diet and how does it help prevent cases of dental problems? I mean, tooth decay, dental caries, and you know, all those conditions.
So basically, a healthy diet that prevents you from having dental diseases would include diet that is, you know, low of starch, low of sugar, and high in fiber, and high in fruits and vegetables. So we encourage that, you know, try as much as possible not to take your chocolate, your biscuits, your candy, so that you prevent dental you know, conditions, and increase your vegetable intake. Take sugar-free gum, because when you take when you chew gum, you're having stimulation of saliva, which now washes away the bacteria that may cause dental conditions. Rinse your mouth after taking you know, liquids with high sugar. Yeah, don't leave the sugar in the mouth. Yeah, because
bacteria
now you
will thrive.
Exactly. Yeah. Exactly.
Okay. And what about because we have some people who take too much caffeine or carbonated drinks as well, and of course this is a problem. We just to remind the people, because sometimes they'll be like, I try but I cannot stop.
Yes.
So can you talk about then how it affects, or you know, our oral hygiene, and how then do we stop? I know you talked about take some water after, you know, taking some of them, but aside from that, what can they do?
Now, coffee, tea, a lot of intake of coffee and tea can cause what we call extrinsic staining of the teeth. Extrinsic staining basically is having stains of the food particles on the outside part of it. So we encourage patients not to take a lot of them, because you know, they come with stains, and this can also aggravate the gum disease. What was the second question?
The second question was then, are there, could we, are there things they can...
The cafe,
yes.
Yeah, okay, let me just explain the carbonated drinks. When you take carbonated drinks, drinks and you know, drinks that are high in acid, they can actually cause what we call tooth surface loss. Okay, because the acid now causes erosion of the teeth, and when you have erosion of the teeth, you're exposing your inner layer of the teeth to external injury. So you find the patients coming with a lot of sensitivity. So it's important to you know, reduce the
Can you reverse it? Let's say, I mean, exposed your tooth to all that, and then cases of sensitivity. Are there things that you can do? Because I know that some toothpaste where they help you manage cases of sensitivity, but can you reverse? You know.
Well, it depends. If it's mild, it can be reversed. If it's severe, you may need to have intervention. Yeah. So in the clinic, we normally do what we call fluoride therapy. We use a fluoride gel to manage the sensitivity. But we encourage patients to also use certain brands of toothpaste which have high fluoride content. And this can be able to you know, manage the sensitivity. Then, of course, we encourage that you don't take extreme cold and extreme hot drinks. And
especially for toothpaste with high fluoride content, are they supposed to use it then for lifetime, or they can stop at some point?
Well, depending on how quickly the sensitivity goes away, and depending on the severity of the sensitivity. There are patients who come with, you know, really severe sensitivity, so they will be on fluoride therapy for quite some time. Yeah, But the key thing is to always manage the sensitivity when it has been diagnosed. Yeah, because we try as much as possible to avoid prolonged treatment of sensitivity.
Yeah.
Yeah. So compliance is very important.
Okay.
Yeah. So you need to come to your dentist, have your fillings done, because there are other reasons as why somebody may have sensitivity, not just gum disease. Could have multiple cavities on their teeth, which are causing sensitivity. Remember, the second layer and the third layer have nerves.
Yeah.
So when you have holes on the teeth, the cavity is basically open.
Yeah.
So food, water, drinks gets there, and then you get sensitivity.
Yeah.
So there are other ways of managing sensitivity, not just your fluoride.
Okay.
Yes.
All right, because there's some people who use even, especially toothpaste with high fluoride, even when they do not have conditions with sensitivity. So I don't know if that's safe or not. I think that's like a yes or no answer, because we need to end the show right now. Do they or do they not? If you do not have cases of sensitivity.
It will not have an effect.
It will not have an effect.
Yeah, exactly. As long as the fluoride levels are safe.
Okay.
Yes, exactly.
Okay.
Yeah.
All right. And that is where we have to end the show. Thank you so much for coming by today.
Thank
and of
you.
course, just helping us understand on matters, oral hygiene, because it's very, very, very important for all of us to just ensure that we maintain good oral hygiene, not only for ourselves, but even for the people around us. And thank you so much for staying with us as well until the end of the show. For those who asked your questions, I believe that you have been answered. And for those of you who have not been able to answer your question, don't worry, we'll still have another episode of the same, and we'll try as much as possible and answer all your questions. My name is Winnie Lubembe. On behalf of an amazing team who put together this show, we wish you a lovely day ahead. See you again tomorrow, same time, same place. God bless.